First is Milwaukee. It is about T6 gold standard, 20 to 40 degrees, and it should be worn 23 hours a day. So Milwaukee brace is an active corrective spinal orthosis. It consists of a neck ring with a throat mold and two occipital pads to avoid a high pressure in the neck. So the brace is used in the treatment of postural disorders like idiopathic scoliosis or Scheuermann disease. So for the Miami brace, it is below T6 with post opening. It supports the cervical and thoracic spine by preventing flexion, which is the forward movement, and extension for the backward movements, and rotation for sideways movement. So next is the Boston brace. So this is the most common, custom fit, more cosmetic than Milwaukee, below T8 with post opening. So it works by applying corrective pressure on the convex, which is the outer side of the curve, and cutting out corresponding areas of relief of the concave, which is the inner side of the curve, so the spine can migrate in the direction. So the brace opens in the back so the patient may need help getting into and out of it. So this is a sample picture of Boston brace. So next is Wilmington brace. So it is below T8 with anterior opening. TLSO low profile scoliosis orthosis provide three principles: and point control, transverse loading, and curve correction. It is to prevent curve progression and to stabilize the spine. So this type is similar to the Boston brace. It's made of the same material and fits like a jacket, but it closes in the front. It's custom made for you using a plaster mold of your torso.
The Wilmington brace is a common thoracolumbosacral orthosis. Unlike the Boston brace, Wilmington is a custom-fitted based on a cast taken of a patient while lying in supine. After the cast is made, corrective forces specific to the patient's spinal curve are added before the brace is completed. This brace goes onto the body similar to a tight jacket and is known as a full contact TLSO due to its lack of gaps or open spots. Wilmington brace is a low-profile scoliosis orthosis. It is to prevent the progression of the spine curvature and also to provide spine stability. Lumbosacral corset is also a type of scoliosis orthosis that provides stabilization of symphysis pubis and sacroiliac joint. It increases the intra-abdominal pressure, decreases the load in the intervertebral disc, and increase the stability of the vertebral spine. It is also used in patients who experience low back pain and postpartum patients. For the SCI patient, it is to assist in their respiration. The advantages of using lumbosacral corset: patients who are using this corset becomes dependent due to the relief they experience while using this orthosis. And also, another disadvantage, it promotes lumbar instability with prolonged use.
In reference to the slide a while ago about lumbosacral corset, it says there that one of the function of your lumbosacral corset is to aid SCI patient for respiration. So why does it aid? Because when you have an SCI patient who had a lesion on the higher levels of your vertebrae, let's say C5, C6, na siya tendency to have difficulty in breathing because na impair ang function ni diaphragm. So let's go back to the basic anatomy, the muscles of respiration. So you have inspiration and expiration. So the primary muscles for inspiration is your diaphragm and your external intercostals. Meanwhile, your expiration is just a recoil of your diaphragm. So, ang active lang si diaphragm is during inspiration. So, pag expire ang patient or mag-breathe out si patient, recoil lang dapat siya ni diaphragm. However, since naa siya SCI, maglisod si patient for expiration. That's why mo-aid si lumbosacral corset para i-push back niya ang imuhang abdominal area to aid the diaphragm muscle for recoil para maka-expirate si patient. So additional information, we have also accessory muscles for inspirations. We have you have your scalenes, your SCM, your upper trapezius, your pec major and minor. Meanwhile, accessory muscle for expiration, you have your abdominals and your internal intercostals.
Chair back brace. It is suitable for when post-operative stability is required. The lightweight spinal orthosis of the chair back brace maintains the spine in a neutral and stable position and is anatomically shaped for easy fitting. It provides limitation of flexion and extension of the trunk. It also provides elevation of intra-abdominal pressure. The indications for the chair back brace are degenerative disc disease, herniated disc, spondylolisthesis, and mechanical low back pain. And for post-surgical supports for lumbar laminectomies, fusions, or discectomies. Contraindications: unstable fractures or conditions in the upper lumbar or thoracic area. This is an example of a chair back brace orthosis. Taylor and Knight Taylor orthosis. It provides control of the flexion, extension, and lateral flexion and rotation of the trunk by the 3-point pressure systems. Flexion is controlled by the posteriorly directed forces applied through the auxiliary straps and the abdominal apron, and an anteriorly directed force through the paraspinal uprights. Indications for post-surgical support of traumatic fractures, spondylolisthesis, scoliosis, spinal stenosis, herniated disc, and disc infections. The contraindications: unstable fractures that require maximum stabilization. An example of a Taylor and Knight Taylor orthosis.
So just to review, spinal stenosis is narrowing of your spinal canal. So normal diameter of your spinal canal, it's 17 millimeter. Meanwhile, your spinal cord's normal diameter is just 10 millimeters. So you have approximately 7 millimeter of free space. Meanwhile, for spinal stenosis, mas nag-narrow pa to 17 mm ang imuhang spinal canal. That's why ma-impinge si spinal cord and it would cause pain. Also, as a review, spondylolisthesis is the forward displacement or anterior displacement of your pars interarticularis. So in the next slide, you can see there a radiograph or an expected outcome of a radiograph of a patient who suffered with spondylolisthesis. Upon x-ray lang ninyo siya makita ang Scotty dog decapitated. Okay? It is not the other term for spondylolisthesis. However, it is only the expected radiograph impression upon x-ray.
William controls extension and lateral flexion. It provides 3.4 system consisting of posteriorly directed force from the abdominal support and anteriorly directed forces from pelvic thoracic bands. Orthosis used for the thoracolumbar area. First, Taylor. It controls flexion and extension. This is used as post-surgical support. Second, Knight Taylor. It controls flexion, extension, and lateral flexion. This is indicated for geriatric patients. Third, Cowhorn. It controls flexion, lateral flexion, and rotation. Hyperextension brace to prevent slouching. Plastic TLS jacket, it controls flexion, extension, lateral flexion, and rotation. It is indicated for SCI patients and provides maximum support. Cruciform anterior spinal hyperextension thoracolumbo-sacral orthosis or CASH. It limits flexion control for the lower thoracic and lumbar regions. Three-point system. Posteriorly directed force through a sternal and suprapubic pad, anteriorly directed force applied through a thoracolumbar pad attached to a strap that extends to the horizontal anterior bar. CASH is indicated for mild compression fracture of lower thoracic and thoracolumbar region, and it is contraindicated on unstable fracture or burst fracture. Also, subclavicular pads may be added to help distribute pressure. Cash brace is strapped around the thoracolumbar region. It has featuring pads to support the sternal and pelvic area. The cross-shaped bar can be adjusted. It is used to immobilize the thoracic and lumbar region in case of vertebral fractures.
Gyrate hyperextension thoracolumbar orthosis. This orthosis aims to provide flexion control for the lower thoracic and lumbar regions, and this orthosis has lateral support, and this orthosis is also provide um, or prevent the spine from twisting, and this is also used to keep your spine in correct position while you are healing from an injury or surgery. This orthosis is a diamond shaped in appearance with pad at the sternal region and lower abdomen, and additionally this orthosis has a posterior strap which completes the hyperextension of this brace. Then this brace is um, usually worn when the patient is um, going to shower, um, while sitting, walking, or in the car. Then usually they take off this orthosis when the doctor um, lays the patient down at the clinic, or when the patient is um, about to sleep at night. Then this brace has a 3-point pressure system, posteriorly directed forces through a sternal and suprapubic pad, anteriorly directed force applied through the thoracolumbar pad attached to the strap that extends to the lateral upright. Indication for Jewett brace is this is for mild compression fracture of the lower thoracic and thoracolumbar regions, then has more lateral support than cash. Then for contraindication, um, if the patient has unstable fracture or burst fracture and sternal fracture. Special considerations is if there is excessive pressure on the sternum might result in a poor compliance with wearing schedule. Subscapular pads can be added to help distribute this pressure. Then when wearing this orthos is the following activities should be avoided while wearing this brace. So first is the patient must avoid doing flexion, then twisting movement of the body, driving a motor vehicle, or sports like running, then lifting heavy objects. Again, Jewett brace gives support to your thoracic and lumbar spine by preventing twisting and flexion. Then surgeries may be required to treat some injuries, but if you are wearing a Jewett brace, injuries can take up to 3 months to heal.